Are you looking for real hair transplant results in which there is no trick photography or Photoshop being done to increase or enhance the results, which is being seen sometimes nowadays? Keep watching this video of a grade 4 male pattern baldness patient showing a realistic transformation. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and performing hair transplant since 2006. Also in this video, we are going to talk about an app which we have made for the first time, and it gives you a peek or shows you the kind of results you can expect after your hair transplant. So this 28-year-old male patient came to us with a history of hair loss expanded to around 6 to 7 years. His hair loss kept on progressing slowly but steadily to his present condition, where currently he was suffering from grade 4 male pattern baldness. In his case, we did the trichoscopy first. So we found out that his donor site had an average density of 82 follicular units per centimeter square. His average thickness of hairs in the donor site or the follicles was 0.075 millimeters. Also, his total donor site area was 140 centimeters square, and his total number of follicular units currently available were more than 11,400. His coverage value was around 13.53. His average number of hairs per follicular unit were also good. They were 2.2. So with this trichoscopic finding, we discussed these findings in detail with the patient. Hit the like button in this video. This motivates us to keep on making such useful videos for you. In the next step, we assessed his recipient or the bald and the balding site. We found out after mapping the area and calculating it scientifically, we found out that his area at the recipient site was around 81 centimeters square. We planned to have a density of around 35 follicular units per centimeter square in his case. So in totality, he needed around 2,850 grafts in his case. The number of 1, 2, 3, 4 hair follicular units are shown on the screen with total number of hairs in these many follicular units. If you want to plan your hair transplant with us, you can call us at the numbers mentioned, or if you are living in some other time zones and you want to connect with us, you can send your WhatsApp message to us on these numbers so that we can try to revert out back to you and try to help you out with your hair transplant planning at Saraswat Hospital Agra. Then after doing his blood test, started with his procedure. Here we marked his hairline. We used laser device to mark this hairline. We tried to make it irregular because a straight hairline looks very bad. After this, we trimmed his hair, gave local anesthesia, gave antibiotics, and then we made the site creation, in which we make the slits using some fine devices. After that, extracted the required number of grafts. So with us, we show you the number of grafts we have taken out. We use a fresh punch made from the best punch makers from the world, and those are the punch we use for the extraction of your follicular unit. So after this was done, the grafts are sorted into 1, 2, 3, 4 hair grafts, and then our technical team starts with the insertion of these grafts. This patient also kept on coming routinely and regularly for his follow-up visits. He kept on taking the PRP, showed us the kind of progress, and when he came at around 15 months, we were very pleased to find out that his results were very good. We request you to subscribe to our Saraswat Hospital Hair Transplant channel. Now coming to Saraswat Hospital App, it's an app available on both iOS as well as the Android or the Google Play Store. In this, when you fill up an information, you can get a reasonably good prediction of the kind of results you can expect after your hair transplant. It's absolutely free, and the link to this app is given in the description below. Before wrapping this video, I would like you to note down a few messages about choosing the hair transplant clinic. Obviously, the first one is to look out for the degrees or the qualifications and the credentials of the doctor. Second thing is to check out if the clinic is routinely doing higher number of grafts, giga sessions, more than 3,500 grafts in a single sitting. In our hospital, we are routinely doing a huge number of grafts in a single day, single sitting, because our team is with us for last 17-18 years and everybody knows what has to be done at which step. Then the third thing is to see how the transparency of the graft or the follicular unit extracted is maintained in the clinic. In our setup, as we have discussed, we show the number of grafts on the machine itself. Fourth thing is how your hair transplant is planned. If your doctor just comes and says that you need, just looking at your scalp says 2500 grafts or 3000 or 3500 grafts, I think this is not the proper way, and you should always reconsider your options if your doctor is just throwing out some numbers to you about the number of grafts used. Number 5 is to check out the involvement of your doctor in your hair transplant. How much is the involvement of the doctors in your procedure? Ideally, the doctor should be there doing the local anesthesia, site creation, graft extraction. As per the ISHRS and ABHRS guidelines, all the clinics or the doctors, they take the help of their technical staff in the insertion. So if your doctor is just there for a couple of minutes drawing some lines and running away and not doing anything personally to you, I think it's a red flag, and you should always consider that this is not the way. You should always discuss these things with your doctor or the clinic in advance. If you are planning a hair transplant for yourself or your family members, please share this useful, informative videos for them to see how actually a planning is done for hair transplant. If you want to know the factors which affect the cost of hair transplant, you can click the video on the left, and if you want to see another patient of ours who has undergone a hair transplant with us, you can click the video on the right.